Hello and welcome to today's webinar Wednesday, Network Spotlight, Maryland Family Association, provided by the National Family Support Network. We are so glad you are here for today's webinar. My name is Robin Shumwell, and I'm an administrative coordinator at the National Family Support Network, and I'll be your moderator today. If you are joining us online, you may listen directly through your computer speakers. If you have joined via the phone number that Zoom provided you, your line has been muted to minimize background noise. For those of you online, please note the link to the Dropbox folder in the chat. Here you'll see that there are some handouts available for download. In addition, you may put questions in the question section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all your questions to the Q&A section of Zoom. If you're having any tech issues, our live tech support will be here to help you. And I will try to get to all questions at the end of the webinar. And if I'm unable to, someone from the NFSN will follow up after the webinar. Also, today's PowerPoint handouts and a recording of the webinar will be available on the NFSN website on the Webinar Wednesday page this time tomorrow. When you exit the webinar, an evaluation will automatically appear on your screen. We do ask that you take a moment to complete this as it provides us with valuable feedback to inform future webinars. So we are going to start off with a couple of poll questions here today to get to know who is in this virtual space. So first, we want to know if you can please, based on this map, if you will please identify which region of the country or the globe that you are in. So it'll take about 30 seconds or so for this. So you can identify if you're joining us from the West, the Midwest, Northeast, South, Canada, or other international, and take a look to see who is joining us in the room today. So you take about 10 more seconds or so, and then we'll see who is here. All right, let's see who is in the room. Okay, so it looks like we have representation from the 4 regions in the US. So we have the Northeast representing about 21%, South and the Midwest at 29%, and the West Coast at 21%. Thank you all for being here today. All right, now to move on to our second poll here, we have another question. We would like to know, what is your affiliation? Are you working in a family resource center network, another family support program maybe? See if we have some parent leaders in the room, some people in early care and education, government, private funders. See who's here today. We'll take about 10 more seconds. All right, let's see what we have. Okay, so it looks like we have a big about almost half are from something different. So not an FRC, a Family Resource Center network, but I do see family resource centers and family resource center networks represented along with government agencies and private funders. So thank you all for being here. Now, our final question here is, which level do you work at? This is our final poll question. Are you at a policy or systems level, management level, program or direct service level, or something different? Take about 10 more seconds here, find out where everybody, what level you're at. All right, let's take a look at the results. Great. Okay, so we've got the most amount coming from management level at about 43%, followed by program or direct service level, and then our policy and systems level folks, and then 14% representing other. Thank you so much for answering those poll questions. We can get to know you. So I would like to say a quick word on the National Family Support Network. So the NFSN is comprised of state networks of family resource centers founded in 2011 by 9 states. Over the last decade, the NFSN has quadrupled in size to now have 37 member networks, 36 states and DC, that represent more than 3,000 family resource centers that serve more than 2 million people annually. The newest member is Louisiana, who joined in June. And today you'll be hearing about Maryland as one of those wonderful states doing this work. The mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. Our vision, simply put, is to have that whole map turn green so that all families will have access to quality family support services in their communities, provided by FRCs, supported by strong networks. If you happen to be from a state that is not currently green on this map, we would love to talk to you. So now to go over what we will be doing today, after this brief introduction, we'll discuss FRC networks and zoom in on the Maryland network. First hearing from network leadership, then we'll talk about 3 of the FRCs in Maryland that are a part of the network. Then we will briefly go over some resources and opportunities from the national network that may be of interest to you. And then at the end of the session, there will be a brief evaluation. Again, the recording of today's webinar and the materials will be available on the national network website by this time tomorrow. So first, Family Resource Centers, or FRCs. A Family Resource Center is a community or school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. Thousands of family resource centers have emerged organically across the country, yet there is no dedicated federal funding, and their existence is largely under the radar as America's best kept secret. Generally, people have heard about that. People have heard about them and think that they're the best thing since sliced bread, or they just haven't heard about them. The top image here is from a community-based family resource center in Vermont, and the bottom image is from a school-based family resource center in Kentucky. So again, these family resource centers can look different, being community-based or school-based, as you can see here. Now, looking one level up, we talk about how family resource centers are connected. So not only have cities, counties, and states hit upon the value of family resource centers, but they also see the value of networking together to leverage their collective impact. So family resource center networks consist of 2 or more family resource centers and ensure the coordinated quality support for the families. They also serve as the backbone entity to leverage that collective impact. And they may be an independent nonprofit coordinated by a public or private funder, or be led by FRC directors serving as volunteer leadership. So again, those family resource center networks look very different depending on the types of things that they're focused on. Yet there are some common functions that we have seen through research that was conducted by the Robert Johnson Foundation a few years ago. The most common things that networks focus on include to increase connectedness, coordination, cooperation, and collaboration amongst members. So the 4 C's. They also provide training and technical assistance, work on advocacy policy and legislation, and provide and maintain a shared data tracking system. We talk about networks in 2 different ways that can be categorized. The first, with the 3 stages of network development related to how long they've been in existence. So we could have emerging networks that are 0 to 3 years, evolving networks who have been established for 3 to 5, or as an established network that has been established for 5+ years, like the Maryland network that we will be talking about today. Then we also talk about the types of networks. You could have a volunteer coordinated one led by Family Resource Center directors themselves in voluntary leadership positions without paid network staff. You could also have funder coordinated that are led by a public department or foundation that both funds and convenes the centers, or you could have an independent staffed nonprofit organization that functions as a membership alliance with members paying dues. These networks may raise and distribute funds, being an intermediary or not, but either way, typically functioning as membership networks. And Maryland is an example of an independent network. So now I would like to introduce you to our presenters for today. We have Nellie Power, the Chief Program Officer for the Maryland Family Network. We are also joined by Elizabeth Chung. She is the Executive Director for the Asian American Center of Frederick. We also have Erika Serrano. She is the Executive Director of Luna Family Support Center, as well as Jenny Crossley, the Director of the Family Center of Queen Anne's County. So first, I will turn it over to Nellie for her to talk about the network.
Thank you for that. Good afternoon, everybody. Waiting for my first slide. So a little bit about Maryland Family Network. Our mission is clear and obvious. We ensure that very young children have strong families, quality early learning environments, and a champion for their interests. Pretty big task at hand, correct? Next slide. We believe that early childhood is a time of unparalleled growth and learning, and that childhood experiences create the foundation for all future social, emotional, cognitive, and physical development. And so that is why our family support centers, as we call them, FSCs, focus on early childhood, very young children and their families. Next slide, please. So we believe that family support centers support the strong families to build resiliency, to develop the social networks, etc., and really foster their child's development. So the focus is on a two-generational approach, working with both children and families in the centers. Next slide. Oh, can you go back? Another thing to know about Maryland Family Network is that this is not all that we do. We definitely operate our network of family support centers, but also we are the largest early Head Start grantee in Maryland. We are the community-based child abuse prevention state lead. And I think I saw my friend Cynthia in the audience from the Friends group. We oversee a network of child care resource centers and also provide high quality access and information resource referral for folks seeking childcare. And have a network of family resource specialists who also help link them with other resources. So what we're able to do is really address needs on multiple sort of planes in the state of Maryland. Okay, next slide. So our movement began many years ago in 1985, and in response to rising infant mortality, teen pregnancy rates, child abuse reports, and an increase in foster care placements. And so our originators thought we really need to think about intervening early and providing supports to family to prevent some of those outcomes. And the initial FSCs, as we call them, were funded through public partnerships, the Department of Human Resources, which is our child welfare arm, some foundations, etc. And Friends of the Family, which is one of our two founding agencies, which then merged to become Maryland Family Network, was established in 1986 to be an intermediary to really oversee the network and to grow the movement and to ensure quality and consistency across our family support centers. Next slide. The funding of family support centers in Maryland is primarily funded through the Maryland State Department of Education. Current funding amount and allocation for each center is $330,000 per center. And we also allocate about $30,000 per center from our community-based child abuse prevention grants, with the awareness that our family support centers are primary prevention tools in the communities to ensure that families are strong and thriving. Our model, oh, can you go back? Our model has the funds coming to Maryland Family Network, and then we are the intermediary who passes those funds along to our sponsoring agencies, who really oversee the day-to-day operations and ensure that they have additional funding, et cetera, to support the family support centers. Because, as you may suspect, $360,000 from us does not fully support the operations of a family support center. So the full cost for each family support center in Maryland range from about $450,000 for a smaller center, perhaps in a rural area, to one of our larger centers that is close to $2 million a year. And the exciting news in Maryland is that a couple of years ago, the Blueprint for Maryland's Future, which was legislation to address the educational system in Maryland, included funding to allocate funds for 3 new centers a year for 10 years. So we have a big task ahead of us to ensure that the expansion goes smoothly and that we're identifying communities where a family support center is really needed. Next slide. So I'm going to hand it over to Jenny Crossley, who is the director of one of our current family support centers, a legacy center that's been around for a while. And she's going to talk a little bit about this is how family support centers have operated for a number of years in partnership with Maryland Family Network. So Jenny, I'm kicking it to you.
Thank you, Nellie. Good afternoon, everyone. My name is Jenny Crossley. I am the director of the Family Center of Queen Anne's County. And as you see at the bottom, our sponsoring agency is Queen Anne's County Public Schools. Next slide. So our mission is to empower parents and children to shine. Our vision, to empower and encourage families to reach their highest potential. We help provide the best possible start in life for families through a nurturing and welcoming environment. We're committed to working in partnership with families while respecting individual and family strengths. Our goal is to support families in Queen Anne's County with young children prenatal until their fourth birthday, and becoming prepared for school success and empowering and educating parents to be their child's first and most important teacher. Our center is sponsored by Queen Anne's County Public Schools. Funding is provided with Maryland Family Network, Queen Anne's County Commissioners, and the generous community with various donations. Who do we serve? We serve parents and or legal guardians who are pregnant or have children age 3 or under in Queen Anne's County. Our service area, as you see, we are a very rural area. We are located in Sudlersville, which is in the north end of the county, and we are a countywide program. So we do serve the entire county. You see that the Eastern Shore is pretty long and wide. So, but located in the north, that can be challenging for us to meet all of those families. Families that attend our center or enrolled in our center have options. We have a center-based program or a home visiting program. The center-based families participate in center activities for up to 4 days a week in the morning and or the afternoon. We have 3 classrooms at our center: Babyland, Tweenytown, and Little Learners. Placement of the children are based on the age and development of the child. Parents participate in group activities while children are in the classrooms. And we also have ESL on site in partnership with Chesapeake College. And ESL stands for English as a Second Language. And our visiting home-based program, the home visitor schedules 60 to 90-minute visits with the family each week, minimum 3 times a month. We use the PAT curriculum parents as teachers to work with the parents and children in their home. Visits usually take any time during the time of 8 a.m. to 3:30 p.m., but we do have other times available to meet the family's schedule and their needs. Flexibility allows families to participate without having to drive to the center, because if you remember before, we're a very rural county. Next slide. Family Support Center core services. So the core services that we offer for our program is a self-sufficiency program, parent education, which parent education would be a formal or informal parent education. We use the nurturing program or the circle security program for our parents, the infant and toddler program when the children are in their classrooms. Service coordination, we help link services to families and resources to meet their needs. Health education, which can be cooking classes, anything related to health information, things like that. And home intervention, which is our home visiting program. Parent support and involvement, we really utilize our parents for support with helping to gear our program to meet their needs. So they really are a big help with parent leadership and things like that for our program. We also do outreach, collaboration, and resource development. And for Maryland Family Network required centers to serve 100 families for the year, and the home visiting program to serve 35 families during that FY year. Next slide. Okay, I wanted to mention a little bit about how COVID-19 impacted us and what we were offering now since in-person options were limited, because I think that's an important part of our program and how things began to change. So next slide. So here's a few pictures that we have. You can see that the child is actually having a meeting online with the teachers. We have graduation for our students. So we went into their homes and brought their backpacks and met them outside to give their backpacks to them and take pictures and things like that. And there's a little slide of saying that we miss them and they miss us and everything like that. Next slide. Virtual offerings. These are the offerings that we decided to do while COVID was happening. Bi-weekly activity packs were delivered to families, which included flyers, parent information, health information. We also provided some educational materials for our ESL families so they wouldn't fall too far behind. Additional materials as needed with clothing and food and things like that. We also created during that time a private Facebook group for the enrolled families so they could also communicate with each other, but communicate with us as well, and have mental health support, information, things like that. We also utilize virtual class meetings through Google Meet. We did Facebook Live presentations, team meetings, and things like that as well during that time. Next slide. Some additional offerings, one-on-one. Again, we did FaceTime, Google Meet, whatever worked for the families so we can keep their engagement. Family groups by our service coordinator were offered, which with the parents. We did parent check-in, coffee talks, parent advisory, parent cafe. We are also fortunate to have a mental health consultant. So Dr. Schaefer was able to meet with families and staff to keep providing those services to families. We also have a donation room, which is available by appointment. And we also did donation days for the families so they can come in and get the things that they need. So we had 3 events and we served 26 different families during that time. Okay. Streamlining paperwork during this time was very challenging for us, but it's also a great way that we still meet the needs for the families and get all of our paperwork and things like that. So we met them at their home, we met them at the park, we did in person, we did paper copies, drop-offs during the activity bags over the phone. We met them virtually with Google Meets, FaceTime, things like that. We also decided to do Google Forms that would help continue to do their goals, center enrollment, referrals, and things like that as well. The next slide will show you our outreach form that we use. These are our flyers with QR code. This day and age, a lot of people are like scanning those little QR codes to get things that they need. So that takes you to our referral form, and we will get them in our email once a family fills those out. Okay, and yes, this is our, back one more, sorry. So the QR code, this is the referral link that I was talking about. It's in English and in Spanish. And then the next slide, just some family fun events that we do. We have a local farm that we visit quite often, which is Godfrey's Farm. We do a lot of theme activities every month. And also we have a lot of partners that we can't do what we do without them. And one of our partners is Bedtime in a Box. So there's some little ones receiving their bedtime in a box and they absolutely love them. And I am going to stop there. And then I will kick it back to Nellie.
Thank you, Jenny. That was amazing. Thank you. And so you can see that Jenny and her center had to adapt and make a lot of shifts during COVID. And Maryland Family Network had to do the same in the midst of also being required to consider expansion throughout the state. So it has been a challenging time, and it really was a good time to sort of turn inward and do some self-assessment in the way that we considered centers as applicants. So there are What you see in front of you is a map of what we're calling full. It's not quite the right terminology of Family Support Center locations in Maryland. And we say that because we also have early Head Start programs throughout the state of Maryland that do get family support funding through the Maryland State Department of Education. And those funds range in smaller amounts, under $330,000, definitely. I'm going to focus today on the family support centers that sort of provide the full array of family support services, whether that was our historical model or the model that's evolved over the past couple of years that I'm going to tell you more about. So what you can see is the state of Maryland. Maryland is a wonderful state with a lot of sort of geographic and ethnic diversity. So we have an oceans, we have mountains, we have urban areas, and we have very rural communities. And you can see by the purple stars that those are our current family support center locations. So you see that they're sort of in multiple communities in the state. The area that is sort of in lavender are areas where we have an intended or a family support center that is in planning. And I'll tell you more about what that means in future slides. But so you can see that we are beginning this mandated and excited expansion throughout the state, and that we are embarking upon a pretty significant series of changes associated with bringing those on board. Next slide, please. So our role has always been to be the intermediary, and really that just means that we receive the funding from the funders, and we oversee contracts with all of the sponsoring agencies to provide the services, and each of those sponsoring agencies is really unique. So what we're able to do is provide that quality assurance, the program consultation to each center to support them individually and how to best meet the needs of their community, and we do that through comprehensive training, lots of technical assistance. We monitor their programs and all of the data that's collected and the deliverables that they're required to provide, and we evaluate how things are going. We also facilitate a lot of peer-to-peer learning, which has actually expanded during the pandemic because we've realized there are so many platforms that we can share information and come together, even if we're not coming together in person, because it might take people from across the state multiple hours to travel to a central location. And then you have to deal with the challenges of a commute or an overnight stay. So the pandemic has really helped us evolve in the way that we come together in fellowship and in learning. We also have a significant role in advocacy. So our public policy department at Maryland Family Network is very, very well regarded and has really had a significant role in pushing through legislation that has changed lives of parents and children throughout the state of Maryland. And so I could rave about that for hours, but we'll focus now on the family support centers. And of course, we have, along with lots of other entities throughout the United States and internationally, been really thinking about how we bring a diversity, equity, and inclusion and anti-racist lens to our work, especially our work as an intermediary and in quality oversight. So as we thought about that, and as we thought about this task, this big task of explaining the network, we really wanted to think about our applicant pool. And so we introduced a couple of years ago a two-track approach to applying to be a family support center provider. So whereas previously we would have expected an agency to be a well-established governmental entity or nonprofit organization with fiscal and programmatic infrastructures in place to essentially just be ready to launch their program, we really took a hard look at that requirement and thought we want to invite more people to come to the table and apply to be a family support center provider. We want to invite grassroots organizations. We want to invite organizations that may be just starting out, who need a lot more support in building those fiscal and programmatic infrastructures. So we created a planning grant track in order to invite agencies to sort of come aboard and have a little on-ramp for planning and to build those fiscal and programmatic infrastructures and for us to help them with it. So next slide. We also, as I mentioned earlier, embarked upon a little bit of an inward look to say, how is Maryland Family Network doing in our role as intermediary? So in early 2022, we engaged Andrew Russo, the executive director of the National Family Support Network, to help us do a lot of stakeholder interviews. So we interviewed our funders, we interviewed people who we fund, we interviewed our own staff, we interviewed community members, just to talk about how are we doing as Maryland Family Network in our work, specifically in the oversight and support of family support centers. And this resulted in a really extensive report identifying 10 key themes for some consideration in how we move forward in our work. I'm not going to talk about all of those today, but we are going to highlight some of them. In addition, we always do a participant satisfaction survey, but this year we added in a number of questions that really sort of targeted the child abuse prevention related aspects of family support work, in addition to how families were feeling valued and appreciated within their own culture and how they were feeling respected. So we really wanted to start getting at were we as culturally competent and thoughtful in the delivery of services as we aspire to be. And of course, our ongoing goal is to continue this 2-track process for new centers. We are going to continue to issue planning grants and implementation grants. And I can tell you that it's been very successful. Right now, we have, through that process, onboarded 3 additional family support centers under the Blueprint funding, and we have 5 in the planning grant process who are very close to being ready to open. And you'll hear a little bit from some of those planning grantees shortly. Next slide. So I just wanted to brag a little bit about how well regarded the centers are in their delivery of services to families. Some of you may be familiar with the Net Promoter Score, and that's a survey question where you're sort of asked, how likely is it that you would recommend this center to a friend or family member who's in a similar situation? And if you answer on a scale of 1 to 10, either a 9 or a 10, then you are considered a promoter. And 91% of our respondents scored our centers, and these are program participants at all of our centers, these are aggregate numbers, as a 9 or a 10. That is phenomenal. I can tell you that if you benchmark it for other human services, sort of social services agencies around the United States, the numbers are closer to, there's a 64 Net Promoter Score. And that doesn't mean that people, have rated those programs poorly. A 7 or 8 is still very, very good. But I wanted to highlight that our centers are already incredibly well regarded. They're already meeting the needs of families in a really spectacular way. Next slide. But we wanted to ask some deeper questions. And because this satisfaction survey went out during COVID, we talked a little bit about how well the center was meeting their needs. And again, we got rave reviews. Next slide. Then we talked a little bit about those strengthening families factors. So how have the services strengthened your relationship with your child? And many respondents said an extreme amount or very much. Next. And then I love this one. It speaks to parent leadership. It speaks to growth and development and personal goals. And many parents noted that as a result of my children's participation in the center, I have bigger goals for myself. So many thanks, Octavia. Sorry, I got distracted. Hi, Octavia. She's a neighbor, and I'm a big fan of their work. So many people said strongly agree related to that value, which I think is something we're very we're proud of the network for that work. Next slide. Again, we're sort of testing how valued and included people feel at the centers. So many respondents, over 90%, indicated that they feel like their voice truly matters at the centers. Next slide. So the self-assessment key themes that we learned from our work with Andrew and in our own satisfaction surveying, and just in anecdotal feedback from a lot of our partners. There was anecdotal feedback from our partners that really led to some of this assessment. And I see Octavia's, our next door neighbor, Octavia Shaw from DC. Actually, Octavia, I'll tell you in a sidebar how you actually inspired some of this self-assessment based on one of our earlier conversations when we were talking about our model. And I realized that we really were in a great, we should take a great opportunity to embark upon some evolution. But the key theme, number 1, from all of our stakeholders and including our internal stakeholders, what is the model that we've been using, which, we are not discarding anything from our previous model, but that really there needed to be some evolution associated with it. And I'll talk more about that. In addition, the role of Maryland Family Network with our sponsoring agencies and to the family support centers needed to shift a little bit. We needed to, the feedback that we got was that we needed to provide a little bit more flexibility and autonomy from the sponsoring agencies and the centers in the way that they developed their service delivery and in the way that they utilized the dollars. Key theme number 3, which I'm sure everybody experiences, is that the dollars that we provide are not fully adequate to support a center. And you know, that's not uncommon in the nonprofit arena. Often agencies are combining funding streams in order to fully flesh out a program. But really that if we are engaged in a situation where there's limitations on resources, that we needed as the intermediary to allow for more flexibility in how those funds were used. So that, for example, if we had required positions, we really wanted to take a look at those details so that we could, again, allow centers more flexibility in how they oversaw their work. And then finally, there's lots of unrealized potential in connecting the dots with family resource centers nationally, and also with our child abuse prevention peers in other states. You know, we just have this rich community of people that are doing amazing work throughout the United States. And we really want to take the opportunity to learn from what other states are doing and maybe steal shamelessly from them a little bit. Next slide. So we took all of that information and said, what are we going to do next? So this past year and currently, we began a process of increasing the individuality in the application of the model for each center. So we invited every center to shift their, what we call their program services proposals. And that's essentially what they say they're going to do in the next year. Previously, while of course we know the clear connection to child abuse prevention, we really wanted to push that point home. And so the new requirement is that every single service have a clear alignment with the Strengthening Families Protective Factor. And we thought that would just be a really beautiful way to have a dark, clear line to child abuse prevention. And everybody would then have that, you know, day-to-day awareness of how their work contributed to prevention. We also slightly changed the way that we categorize the services. So now there are an array of core clusters, and I'll tell you a little bit more about them. Probably more details than you wanted to know, but we're super excited about it. We still have mandatory services that are absolutely essential for the work. But some services have moved from being a requirement to being optional. And that's, again, based on the feedback that we got from our centers, where they might say, you know, this is something that we've been doing, but we just don't really have the numbers to support it. And instead, in this similar service arena, we'd love to do this. And we really think it will be more impactful for our specific community. So we wanted to invite the centers to say, here's what we want to do in our community. Here's why this meets the needs of our community in a better way. And let's paint a picture for you of that. We've always been a 2-generational program supporter, but realized that, you know, there are lots of different family constellations. So we did not want to rule out the possibility that caregivers of, you know, a 3rd generation, a grandparent, or another household member who is a family member could be included in the supports, because perhaps, you know, the biological parent is working multiple shifts, but they are in a multi-generational household, and that grandparent is a primary caretaker and, you know, lover and nurturer of a child, and they should be invited to participate in our support center programming. And then, of course, based on what we've learned from the pandemic, you know, services can be provided in the center for sure, definitely in the home, but maybe also in a variety of community-based settings, in partnerships and in digital modalities. We have centers that started perhaps, say, a story time online, and even though they might be back in full operations and open for business, people loved it. They loved getting on Zoom and reading a book together. So they're going to continue that, and we want to support that and sort of value that as a service and count it in their deliverables. So every center was invited to sort of mix it up and assess what they're doing and make some changes. Next slide. So what I'm going to do now is introduce you to some of our planning grantees so that they can talk about what it's been like, the good, bad, and the ugly, and the challenges that they've encountered in this planning grant process, but really sort of what they have experienced as a new planning grantee. So I'm going to kick it to Erica Serrano of Luna Latinas Unidas. Erica? Oh, and also she's going to hand it off to then Elizabeth Chung from the Asian American Center of Frederick. Thank you.
Thank you,
Erica.
Nelly. Thank you very much for the introduction. Good afternoon, everyone. My name is Erica Serrano, and I am the director of Luna Family Support Center. My partner, Pilar Torres, and I have long experience, about 25 years combined experience working and advocating for the Latino early childhood community here in Maryland. And we both have very deep roots in the community we call home. As social entrepreneurs, we have worked directly with family childcare providers, children, families, receiving several local and national awards and being quoted as experts in the field. But that didn't mean much when we were in need of funds to do our business and continue supporting the community, because our company has been self-funded all this time. We have been working for many years together, but we never had funding from another organization. Next slide, please. So a little background here in Maryland. As you notice, I am a Latino woman, and in Maryland, about 11.2% of the population is Hispanic. And in Montgomery and Prince George's counties, the areas where I live and work, Hispanics comprise about 20% of the population. Since 2010, the number of Hispanics in Maryland has doubled, and Hispanics make by far the largest immigrant group in the state of Maryland. Therefore, Spanish is the second most spoken language after English. Next slide, please. That means that dual language learners are the fastest growing sector of the population, both in the US and in Maryland, and one of the poorest demographic groups. According to the Migration Policy Institute, Maryland ranks 13th in the number of children who have immigrant parents, and about 19% of the children in kindergarten in the state. Next slide. When in 2021, Maryland Family Network put out an RFP, including a segment for an alternate solution proposal, we felt this was an opportunity we could not miss in order to be able to bring very much needed bilingual services to the immigrant non-English native speaking families here in Maryland. There was just a small problem. We were a private LLC company instead of a nonprofit organization. Next slide. So being awarded the Maryland Family Network Planning Grant has proven to be a unique opportunity for us to create a community-based organization that has both the know-how and the financial resources to offer programs customized and language and culturally relevant to address the community needs. Next slide, please. During this planning grant phase, we have been able to incorporate as a 501c3 organization and getting our status as a nonprofit, constitute a board of directors, research and sign with a fiscal agent to offer support in the financial management, search for a location to establish our family support center, establish very solid community partnerships here in our counties, develop, grow, and learn with Maryland Support Network's financial support and mentorship. The mentorship has been invaluable to help us learn and guide us through this process. Luna is expected to enter the startup and fully operating grant in the next couple of months. All this would have not been possible without the vision of Maryland Support Network and its leaders. They understood the need to empower small organizations such as us with the experience and the willpower to work for our communities, but limited funds to do so. So we are very, very grateful and excited to start our new phase. Thank you. Now I pass on to Elizabeth Chung.
Good afternoon, everyone. My name is Elizabeth Chung. I'm the executive director for the Asian American Center Frederick. Though it is Asian American Center Frederick, we serve everyone. The mission is really to equip our immigrant communities with essential skills to be independent, self-sufficient, and make contribution. So again, it is open our door to everyone. So, then we have three very unique, kind of, the process to enhance, empower, and enrich. Think about that. You improve access to services, but you train, our workers so that they can help to enhance services, but you also use, the bilingual skill, bicultural skill. So again, the work that we do is really putting those three words together. And I think that it just, we don't really know, as far as, the proper process, but it's just very organic. It's how we feel. So enhance, empower, and enrich. So next one, please. So we serve, as I said, primarily our, immigrant community, and you can see particularly most recently that we have, from Central Asia, from, Russia, from, Afghanistan, Ethiopia, and so forth. As an agency, we have 40 languages in 25 countries. And then we also focus on the Alice household, which is basically the working poor with assets. The assets limited, incomes constrained, and also, but they're working. So these are the population we serve. Next one. And, how do we do that? And oftentimes, we find that our funding sources oftentimes say, oh, you serve the young, the middle age one or the older one. But as an immigrant communities, we cannot turn away, our communities. They need housing, they need food, they need to take care of the young. They want to know where to get, better education and workforce and so forth. So how do we do it? It's really striving together from cradle to career. And because I'm a public health, professional, so to me that it's just really no, surprise. We need to look at the holistic approach to health. And health is not the absence of disease, and health is not just mental health, physical health, emotional health, but also dental health. So it's just really a holistic approach. But you will see that a lot of factors now that we talk about SDOH, impacting, our health, the outcomes of our own, being. So if you look at, this whole spectrum in here, that is where we, just focus a great deal of social determinants of health in everything that we do. So the next slide, you see that when being a public health, as I said, that, we know that, we have to do a lot of medical delivery services and so forth to keep our, communities, have good access. But it's really 20% of our, costs is only on those, medical services, but the other 80% has a lot to do, with, the other social determinants. So with that being our guiding principles, and that's where when we try to think about what services, our community needs and how can we meet those services. So really as a very grassroots community-based organization, we don't really have a 10 years, 20 years of funding plan when we first started. It has been about 17 years. Next. So in this, since 2005, you see that we want to connect the resources, collaborate resources. So we have language, we have, like I said, 40 languages. We do interpretation, we have education, a lot of, using our cultural, performances to get across. Why do we just keep dancing, like I'm Chinese, in a Chinese community? We need to take those, cultural richness, right, to share with the community so they understand. So we do a lot of volunteer services and through our seniors and through our AmeriCorps. And of course, because we're immigrant serving agency, citizenship is so important. You heard about the public charters? Sometimes, our community was scared about really getting, public services if they cannot and apply for citizenship. There's a lot of systemic barriers that we need to look at, but we continue to find ways to help our community and to become citizen, getting classes and so forth. But the last is really in the recent accomplishment we have is we develop our community health workers. They're from the communities, they have the cultural experiences, they have a language and capacity. So again, I think all of us, we are teachers too, we are health, to advocate. So, but we have to give them the credential, in order to be, recognized. So we're very pleased to become accredited community health workers. Next. And even doing all this, we just do things, as they comes in, right? We want to do, we have prenatal education classes, so you can see on the screen, assets, health fair, and then, our baby showers and cultural event and a foot drop, diaper, drive, library. So we do it day in and day out. In this case, mostly in a maternal child health area. But we never really think about, how can we put all this together until one day, next slide, please. So until we say, oh my goodness, we need to, bring everything together. So, when we heard about the MFN, planning grant, we think that this might be a way that we can help ourselves because we really know what we don't know. Again, we're immigrant serving agency. I'm an immigrant myself. It took me 50 years kind of knowing, okay, go apply this grant, make this work. But we have to think about sustainability. I hope those of you who are listening, watching, and think about how small, we have $0, of course, 17 years ago, and started with the after school, programs and grown into, to much more, comprehensive services. It's all because we listen to the community and let them take part of it. You can see the services where the assets, we have all those services, family community engagement, citizenship, early child education classes, maternal and child health services, workforce development, case management, language resources. So we provide all these services through different grants and so forth. But then what? It's so hard because they are not necessarily linked together. And then until now that, because we address social determinant health, you see that, right, down the dark green, and MFN came in, and thanks to them that they are really providing a great deal more, infrastructures. So again, I'm an immigrant. I do not know what nonprofit is. And then now they're working after just several decades, but we still need help, knowing that what I don't know, knowing that what I don't have, and MFN came in to really help us to take to the next level. It's just so excited. So because ultimately, I still want to see equities, meaning self-sufficiency, independence, and being, a justice in our communities. Next one. So they help us with, this area. I know that they will. They already did, by giving us its planning grant and giving us, the direction. So how do I see what they will be helping me? At least I can tell you what they will be helping me. They really continue to understand, the DEI, with the DEI lens, continue to support us. Like Natalie was saying that, we have the flexibility to do what we think may work for us better. How do we deliver, ESL classes? How do we link, in terms of maternal child health and our diaper drive and our food drive together? And how can we, navigate the funding? And from MFN, now we get the operating funding. I can use those, as my, as my successors and go to, and I do say, I can share that, a congressional funding to support our building. So without, this kind of support, we really do not know, in terms of how soon, how fast, but they help us to link our school system because they gave us the blueprints, right? So we can work with early childhood, work with our Judy Center, work with our family partnership, all of those stakeholders already in the system that, that bring us together. And more importantly, is that we can look at not to duplicate our services. So, I mean, this is ongoing process. I'm going to figure that out, with our stakeholders so that can build further capacity. We don't need to, compete with each other. We need to complement each other. And I think as a small agency, I might say that we don't always have this chance. We just kind of work could be in the community day in and day out to do our work. But now that with the system, with this intermediate system, supporting us, leveraging, for us, with the bigger system, I think that is the beauty of, in my sense, down a process, and I can share with you the process I believe in. Next one. So, it just have more services. You can see, we do a lot of health literacy Okay, go back at once quickly. To me, that's fine. We're gonna stay with this one. So the process until this morning, or just now, did when when Robin was talking about collective impact, I learned. Do you know what collective impact? Do I know what that is? Maybe a year, 2 years ago, probably not. Was I practicing collective impact? Probably yes. So now that it is really put it into the context with the language, I can see that the leadership in MFN providing me that, that resources, that those leadership around the table, and help us to convene the network with Erica, with Jenny, with others, the new partners, and also making sure that we follow through in compliance of the fiscal management and our staffing needs, and also helping us to look at who's supposed to be in our advisory group. But at the same time, we can also give input to say, whom would you believe that can be a part of, maybe a business owner, right? And maybe our benevolent association, leadership. So it's a good way of kind of helping also the system to understand a little bit more about, from my lens, my immigrant cultural lens, what works for my communities. I think that it is beneficial. So again, we are not going to skip data because we're not able to, we don't have a lot of data, but now that this time, hopefully, with this, our support, we were able to know what to collect, when to collect, what make, it meaningful, or make it, really, purposeful, what data do we need to have? So communicating with each other. So I think that is a collective impact model, as I understand that, with the investor, from Maryland Department of Education, from MFN and other, resources, that's equities. So it's really, you taste it, you act on it, you really feel that, touch it. It's not just being, diverse, but it's also operatively, operatively, right? I think that might be the word to use, to put all these pieces together. We're looking forward, to our development. We finished our planning grant. We have a building that we are renovating the first floor. Costs a lot of money, but I'm able to convince, again, the congressional support to help us, to retrofit or remodel the building to the compliance to the law and regulation by, by MFN. So the last slide, I believe, that I have is to say that the next one, this is long-term impact. This is showing up how we can improve health outcome, connect the communities, and then again, to me, that health equities or equities really prosperity. When our communities economically, healthy, then we have good health. So next one. So coming together is a beginning. We did that a year or so ago, and keeping together is a progress. We continue to do that with MFN, and with today sharing with you. So we're successfully, it's a success that we're working together. So share with you, it never goes wrong with what Confucius said, right? When you, the next line, when you want to grow grain, we eat a lot of rice. It takes a year, in terms of the harvest. You plant the seed, you nurture them, you let them grow. But for, if you want to have a tree, then take about 10 years. For people, I think take 100 years. So this very humble beginning and beginning this planning grant, I can see that we're going to give us a long longevities of success in building a healthy communities here, for those of us who call home after we left our home country, but this is my country, and being able to, have the support and continue to build. So thank you very much. And I think I'm going to go back to Natalie, I believe.
I think you got it. Thank you so much. Thank you to both Erica and Elizabeth. I think everybody in the audience can probably tell how excited we are to partner with both of these entities, and how important it is to invest in the work that they are describing. And a number of years ago, perhaps we would not have, they wouldn't have been under consideration because of some of their programmatic limitations and experience. So we're just absolutely thrilled to be working with them. So next slide for me. me. So I wanted to just loop back briefly. We won't go into too much detail, but just talk about all of the lessons learned as we have been working with our planning grantees, as we have been having this deep dive self-assessment conversations with our stakeholders about the way that we want to construct the system so that each center can provide more individualized services and so that they are clearly aligned with the protective factors. We have established a sort of set of core clusters. And Jenny noted at the very beginning, you're going to hear from her again shortly, but she noted sort of here are the expected deliverables, a certain number of families per month at a certain intensity. And that is a wonderful model. And we expect that there will be a number of families that will still continue to come and utilize the center and avail themselves of multiple services, et cetera. But what we found was that we were perhaps limiting our storytelling capacity and truly painting the picture of the wide array of work and supports that these centers were providing by not counting certain specific services or not inviting them to provide those services, or to maybe they were providing them, but they weren't including them in their numbers and weren't including them as part of their funding. They weren't allocating specific resources for them. So what we looked at is that there are 4 core clusters of community connections. And this is an area where we really wanted to get more details about people who have basic needs that are not being met. So that might be food insecurity, it might be a need for diapers, it might be direct financial assistance in times of crisis, et cetera, that we wanted centers to be able to include the delivery of sort of basic needs supports, whether they have a food pantry or they're giving away certain resources, to count those numbers, because again, we're painting that wider picture of the impact. They're doing community-based workshops, lots of information and referral, so they may get a call, hundreds of calls a month, and weren't necessarily capturing that data in a way that we could then share with our funder and with the community at large to say, here are the needs that are out there. And that will allow our centers and us to advocate for them to identify additional sources of funding to support their high quality work. So of course we have a focus on parents and caregiver capacity building. So that includes all of sort of our adult education umbrella work. There might be English as a second language class, teen parent classes, employment readiness, all of the things that you were hearing both Erica and Elizabeth talk about how they are going to, in a unique way, provide those sorts of supports to their specific community. So all of our current centers are also invited to say, here is what we have found our community needs. So whereas previously they might have provided GED services, they might say, you know what, we just don't have the enrollment to justify continuing with that. We're going to partner with this particular peer agency and have a strong collaborative relationship. But instead, here's where we're going to focus our energies in adult education. And coordinated family supports, so adult mental health supports and consultation for the parents that are involved in the centers, case management services, so like how are we identifying what the needs are and how are we linking them to those services, and any sort of in-home intervention services that people are receiving, because sometimes it's just much better to get help in your home when you need it. And the cornerstone of our work is work in early childhood intervention. Our infant toddler programs ensure that there is an incredibly rich learning environment when anybody is at the center. So we pay really close attention and strongly believe that the environment that the kids are encountering and the parents are encountering when they come to any family support center should feel like a wonderland for their learning and for their joy and their supports. And then there are lots of activities that we will host in those settings. We also, with our partner and funder MSDE, really thought about the age range of the children and that were being identified as sort of the core recipient of services. You heard Jenny mention that children up to the age of 3 are the primary recipients, but what some centers reported to us was that, gosh, when kids turn 4, when they pass that 3 years, 11 months mark, they were getting sort of discharged prematurely, some at times without other services to sort of transition to because the community maybe didn't have them. And they really wanted to prolong or extend those supports so that a family didn't feel like there was a gap before that child entered their local school system. Because we definitely can see in lots of communities, there are areas where there are gaps. So what we just allowed in this new process is that centers can serve children up to 4 years, 11 months instead of 3 years, 11 months. with the awareness that if there is a pre-K program or another high quality early learning environment that has availability, they would of course be choosing the environment that made the most sense for that family. But we did not want any gap. We did not want to perpetuate or contribute to any gaps there. And then finally, we talked a little bit about just allowing centers to have a little bit more flexibility in the way that they allocated their dollars, so that they could pack the most punch with the money that we do provide them, knowing that, resources only go so far and we're not able to fully fund, or, the grants that we provide don't provide full funding. So those are the enhancements that we talked about. Next slide. And so you'll see, and this is very small font, I know, but you can see how now the centers are reporting out on what the protective factor is. So it might be concrete supports in times of need. That's a protective factor. Every family needs that. The core cluster area are community connections, and the service that's being provided is direct service to families who receive some sort of assistance. And then we're counting those numbers because we are interested in aggregating that data and rolling it up so that we can report to MSDE and everybody in the universe. Here is the scope of need. Here's how it's being met. And here's where there may be gaps so that we can advocate for additional resources. And so you can see also, they might have a GED or adult education program. There might be different community events where they're being visible and recruiting additional participants, and they're just spreading the word about family support in general, and that has value, and health activities, etc. So this is just an example of one of the new program services proposals and how we're going to aggregate the data. And then the next slide is again just an example of a richer array of numbers that we can use to collect, and then we'll be able to slice and dice it in the ways that I describe and really analyze what are the needs, how are ways that we can better meet those needs, are we attending to our families with a diversity, equity, and inclusion lens? Are we making sure that we're not contributing to any of those institutional barriers that Elizabeth identified? Like if there's a particular community, there's a particular barrier, how are we helping to dismantle it as opposed to potentially perpetuating it? So we're going to roll up all of this data from every single center for every single data point, so that we can paint those pictures. And then next slide. So the goal is that we're going to issue, we've got another round of recruitment for family support centers. So we want to invite additional centers to apply. We do have a cohort of folks who submitted a letter of interest the last time around, and for a number of reasons did not ultimately apply. And I forgot to mention that they were some of the stakeholders that we collected information from in order to develop these enhancements, because they might have said, gosh, your space requirements, that was a challenge, or this particular staffing profile was something that we thought would be a challenge, or the funding was a challenge. So we really took a lot of their feedback in order to inform our next steps. And we're going to be using this next year as a pilot year for this new data collection. And boy, have we learned a lot from people like Erica and Elizabeth related to the planning grant process, especially when it comes to questions that we didn't even consider, when we've encountered setbacks that meant that the timeframes were a lot longer than we expected. And we've also learned that we need to be thinking about how the funding in future years may be more individualized, because a one-size-fits-all approach does not work necessarily. So while we won't reduce the funding for anybody, I don't want anybody to be alarmed, we really want to have some tools and data to support perhaps the opportunity to individualize the funding amounts for each center in the future. So that's an aspiration. Next slide. And so now I want to send it back to Jenny so that she can talk a little bit about what it's been like to encounter all of these invitations to enhance or change, and how her center has approached the new program services proposal process. Jenny?
Thank you, Nellie. So just a little background, I have been in the network for 12 years as of October 18th. And when Maryland Family Network told us that we have the opportunity to individualize our program, I kind of jumped up and down several times. We were very, very excited that we are finally going to get the opportunity to really dive into our community and to meet the needs and to maybe make some possible changes that we have seen that have been needed for quite some time now. So we were extremely extremely excited. So if you can see the excitement in Elizabeth and Erica's faces, know that mine is 10 times that as well, because we are only going to become stronger as a network and also as a family support center here on the Eastern Shore. So program services proposal have been individualized, which is amazing. So we are going to focus on the Strengthening Families model, which has the 5 protective factors that Nellie mentioned earlier. Our program, we can now serve children through the age of 4. So we don't have to say goodbye to those little ones when they turn 3 and they don't have that gap year of not in a program before starting school, and we could still serve that family. In addition, we can also see the parent and legal guardian and have them choose what caregiver gives permission to bring the child into the center or participate in home visits, like the grandparents that we haven't been able to serve up until now, or the aunt that is watching her nephew or niece that really wants to come to the program as well. So that's huge and exciting for us. We are going to return to pre-COVID models. So we're going to have in-person services at the center and home visits in the home. And we're also going to keep some of the things like the virtual piece that we've learned through COVID that working, and we're going to keep doing that. Additional activities scheduled once a month, such as field trips to parks, farms, educational activities, and things like that. Playgroups at the center, which are always very, very well attended and asked for from the parents. Again, the virtual offerings, we're going to have the parent groups, the Facebook groups, the home visiting meetings and things like that, and paperwork online. So a lot of the services that we were doing before COVID, we can continue to do. And we're going to meet those needs of families. We're going to offer services, basic needs services. If they need diapers and wipes and food, or if they need assistance in any other way, we're going to meet that need for them. We're going to give them opportunities for field trips, age appropriate activities for the parents and their children. We're going to do different community-based workshops and classes, what is ever needed, parenting education, health, emergency preparedness, anything that they may need. Different community events, working with our partners, career exploration. We like to give our parents opportunities to be those parent leadership moments where they can talk about their career as well to their parents. All the health education, again, the formal parent education, informal and formal. Parent leadership opportunities. We do the parent essays. So we give parents the opportunity to express how the center has helped them and their children. Case management services, if they need resources in home services, home visiting, adult mental health. We have our mental health consultant that runs groups with our parents and also for our children as well. The infant toddler program, packed activities, parent and children together, because parents are their child's first most important teacher. Different play groups with our partners and things like that. So we're extremely, extremely excited for this opportunity for growth and change for our center. It's going to be a learning experience, but we're all in this together and appreciate and value Maryland Family Network and our sponsoring agency and all of our partners, and plus our sister agencies, our other family support centers and things like that. So next slide, these are one of our 2 favorite pictures. This little guy, he was getting his picture taken, so he wanted to take the photographer's picture as well. So he's one of our favorite little guys, yeah. So this is why we do what we do. And next slide, it is just a photo of me and my tiny but mighty team and my information. We also have our Facebook page listed there, so you can go and see the things that we are doing at our center. So thank you for your time, and I think I'm going to send it back to Robin.
Yes, Jenny, thank you so much. And thank you to all of our awesome panelists, to Nellie, Erica, Elizabeth, and to Jenny. Thank you so much for sharing your knowledge about the work that is going on in Maryland. So now I would love to turn this over to our participants for us to take some questions and answers. If you haven't done so already, please put any questions that you may have into the Q&A so that we can go over this. And then just a quick reminder that there will be a brief survey at the end, so stick around. So let's see. So we have a question from Christopher Brown. He asked, does the network or any individual centers offer father-specific programming such as parent education or activities? Great question.
Jenny, do you want to jump in?
We invite moms and dads to attend our center at all times, whenever they can. So a lot of our dads have attended field trips. They participated in our formal parent education classes and informal parent education classes. We're also doing a book club with our mental health consultant right now. If you've ever heard of the book of 1, 2, 3 Magic. So everyone is reading that book and they're having a group discussion, and some of our dads are participating in that as well. We've also done a nurturing program in the evening with our partner with Department of Social Services, and dads were the target of that group. So we enjoy having moms, dads on site with their families.
That's great. Thank you, Jenny. Let's see, any other questions from our participants at all? All right, well, then I just have a couple more announcements. Again, just a reminder that there will be a brief webinar survey that pops up at the close of the webinar where participants can provide more feedback for the NFSN and also for our wonderful panelists. So I will provide a few more housekeeping items here. Again, thank you so much to all of our wonderful panelists for your time, your presentations, and for engaging in our Q&A as well. So there are some upcoming activities and resources that may be of interest to you from the National Family Support Network. First, next week on the 2nd, we do have an overview of the standards of quality for family strengthening and support. So these are all webinars similar to what you're participating in today. So after the overview, we also have on November 9th, we're going to be doing a webinar on family resource centers and supporting teen parents. So answering the question, why are family resource centers an effective strategy to supporting teen parents? And then later in November on the 16th, we have the launch of our Family Resource Center Learning Hub. So this is going to be an external hub for folks who are not necessarily members of the National Family Support Network, so that they can still be able to access resources that we may have as a national network that smaller FRCs would be able to use that aren't necessarily part of a network yet. All right, and then we also have a standard certification coming up on December 1st and 2nd. You can register at the National Family Support Network for the certification training, as well as all of the webinars. You can register on our website. For the standard certification, check the certification training page to see if your state has a network that currently offers the standard certification training. And then we also have a developing and sustaining effective parent advisory committees training. So this is happening on December 15th and 16th. This is a unique, highly rated virtual program training for program staff to maximize the great potential of parent advisory committees. And this is co-trained by an NFSN staff member and an experienced national parent leader. You can contact us on our website and register also on the website there and contact us to bring a training to your area. Now, I wanted to share a couple of resources that also could be of interest to you in your work. What resources that we offer on our website include overviews of family resource centers, research reports, sample requests for proposals, evaluation plans, videos, and information about data management system. We also have member network snapshots, such as the graphic that you see on your screen for Alabama. That gives you all pertinent information. You would be able to find one for Maryland as well, giving you some information on the network functions and their service area. And then we also have all of the information for the standards of quality for family strengthening support, including opportunities such as the overview webinar that was previously mentioned and opportunities for certification trainings. And then I just wanted to make a mention about services that we offer at the National Family Support Network. So we can facilitate connections to NFSM member networks. We can do presentations for key stakeholders such as education leaders, child welfare leaders, children's trust funds, and other private and public funders about working and investing in family resource centers. We can provide technical assistance for Family Resource Center network development, and we can provide training such as the standard certification training and the training on developing and sustaining effective parent advisory committee trainings. My contact information is here on the screen. Again, I am Robin Shumwell, and a big thank you to everyone participating, and especially to our presenters as well. So thankful that everyone is here today. You can contact me directly with the information on the screen, as well as explore our website at www.nationalfamilysupportnetwork.org. Now, again, thank you so much for joining us today. As a reminder, a brief evaluation will appear on your screen when you exit the webinar. We appreciate your feedback on this evaluation and use your input to plan for future webinars. So thank you all so much and have a wonderful Wednesday.
Thank you, Robin.